Thank you, Mr. Chairman. Thank you, Mr. Secretary and team, for being here. I do want to say that the people of the Commonwealth really appreciate your accessibility as well, and your open door for questions and assistance across the state. We really appreciate that. We are challenged, I guess I would say, with serving a growing number of older Pennsylvanians, but at the same time we're blessed with some really good programs, and of course our challenge is to maintain, sustain, and hopefully continue to fund them. We utilize a number of waivers when we look at the home and community. We look at this constant rebalancing effort that we're all committed to, certainly the home and community-based factor being one of them, and a primary at times. How many waivers, just to educate our committee and the people watching us today, how many waivers do we use in the home and community-based service arena?
There are several waivers, about 4 or 5. We have the aging waiver, which serves persons over the age of 60. We have the Act 150 waiver program. We have the attendant care waiver that serves both under and over 60. We have the ComCare waiver that serves persons with a brain injury, traumatic brain injury. We have the independence waiver and the OBRA waiver. So we have 1, 2, 3, 6.
And 6 of them. Do you mind talking a little bit about the acuity level in each one, or would you rather just supply that to the committee so we all understand what those waivers do?
Why don't we supply that to the committee by definition as to what each waiver is, the population it serves, maybe some current volumes of who we're serving, so you have an idea of what's being addressed.
And then that leads me to the discussion on the way the cost factors are determined. I know originally it was calculated at an individual average cost that would not exceed the Medicaid payment in a nursing home environment, but then at some point changed to use an aggregate amount. Is that the way it's currently done now? That was done, I think, in order to expand the availability. Are they still doing it that way, and is it time to take a look at that? David, if you want to answer that question.
It's currently, all the waiver programs are looked at as an aggregate cost. So the cost on average within the program can exceed the cost of the institutional setting for which the individuals would otherwise be served. As far as looking at changing that, one of the requirements related to the Affordable Care Act is maintaining, if you have an aggregate cost associated with it, maintaining that level. You can't convert it to an individual cost. So it's a maintenance.
I know we're just looking for a way to serve the most people and to keep the most frail individuals at the level of care they need while caring for those that we can in home and community based. I have one other thought that is another growing problematic area, and I want to know what you see your role in the elder financial abuse. We talk about elder abuse at all different levels, but I've actually seen a number of these cases locally, which brings it to my attention very acutely. Oftentimes we see this resulting directly within families. Very few get reported. You know that. I know that. There's lots of reasons for that. There's intimidation factors. There's where am I going to live factors. What would I do without them factors. And aside from that, there's all kinds of scams going on that are happening outside the families too, which are communities and facilities working with seniors are having very difficult time keeping up with, because that comes through the mail. So there are all levels. How do you see your role? Tell me what you're doing. Are you partnering with the AG's office? How can we help with that? Because I do see that growing.
Well, first, we thank Chairs Hennessy and Curry and yourself and all members of the committee for most recently having 2 hearings looking at this very important issue of elder abuse. And in particular, during those hearings, we discussed the growing cases of financial exploitation, as you've indicated. So it is an area of concern that we have through our protective services division of the department. It's an area that we're trying to look into what we can do to enhance skill sets at the local community. We can address it in several different ways. We're right now under consideration a rewrite of the Older Adults Protective Services Act. I can't definitively say what will be in the rewrite or not, but one of the areas we're actually looking at as we think about it is financial exploitation, and do we have to look at revising some of the language and requirements of that statute as to what would be necessary to address the issue. We're also looking at how protective services, we monitor our protective services very closely as they're provided by our 52 area agencies on aging across the Commonwealth. We also want to work as we do those reviews with the area agencies to determine what may be needed at the local level in terms of technical assistance or resources to help in this regard.
Well, I appreciate that, and I think we all recognize that as a key need as we move forward on the protective services. Thank you all for testifying.
Thank you, Representative.
Thank you, Mr. Chairman. Welcome, Mr. Secretary, and your able team. We're happy to have you here. Obviously, it's another beautiful day in Pennsylvania. The weather's nice. We're having a very well-deserved mild winter, although it's getting in the way with our cross-country skiing in our state parks a little bit. The past year, Mother Nature hasn't been quite so gentle with us, and with a lot of the two tropical storms that we had and actually an earthquake that came up through Pennsylvania, we all experienced and witnessed a lot of damage done as a result. How did we fare in our state parks? How much damage was done? I know personally from the one that I use regularly there was some significant damage, but how did it go throughout our state parks? And then tell me what role you did play, and if you have any cost factors there, and actually a timeline for recovery on that. I'd appreciate that.
Sure. We sustained quite a bit of damage out in our park and forest systems. To date, our estimate is around $6 million, and we've submitted this to FEMA for reimbursement, and they're actually out on the ground now doing assessments to review all this damage. The damage, of course, was to roads, bridges, structures, trails, every single type of facility that we have in our parks and forests. But we came back immediately to address the safety and health issues to get what we needed up and running right away. The staff from DCNR were quite involved during the storms. We had personnel 24 hours at FEMA headquarters. But the staff out in the park and forest areas were tremendous in regards to assisting the visitors to the centers. And one story I remember was someone had walked in almost a mile to help someone get out of one of the parks, and helped with flooding by providing pumps. And our topographic and geographic office provided pre and post satellite photos of damage, not only to help the department, but also the Commonwealth in regards to assessing the damage and trying to recover funds to do the repairs. The topographic office also was one of the first to record that earthquake and report it to authorities.
And we've recovered from that damage? Everything's as functional in the parks as it was?
A pretty good amount of it is. We're still going through and addressing where we feel that the immediate needs are as far as the reconstruction.
I ask that because of the season ahead and probably the usage level increasing. We have 117 state parks that we can really be proud of, and I hear people talking about using them all the time, and I use one regularly myself. What would you say when people ask you about any economic impact as a result of the usage and that available resource for people?
We were very proud of a recent update of a study done for our parks, and what we were stating was that for every dollar invested into state parks, there was over a $9 return. Well, that's been updated to now to be over $12 return to the local communities, where the value of about $938 million is now over $1 billion to those communities, and where it supported roughly 10,000 jobs, it's now supporting approximately 13,000 jobs.
Do you have any data on usage, any increase? It seems to me the ones that I am in and out of, I see a high level of usage. Do you have data on any increases, and especially in this economy when it's an affordable recreation opportunity for folks? I'm curious to know what your statistics say.
It's been averaging about 38 million visitors over the last couple years. We believe that not only because of what we provide as far as an affordable type of recreation to our citizens and visitors from out of state, that it's due also to the national economy. People aren't traveling far. They want to use the recreation facilities that are close to home.
And we are blessed with our state parks, unquestionably. With regard to your infrastructure needs and the projects and plans in place, we're looking at a challenged budget, at every different level. So how are you doing with that as far as infrastructure improvements go? Because I can tell you, I watched what was done closely at one in particular, the Pine Grove Furnace State Park, and a marvelous job was done there. And it makes usage just so much easier and better for folks. Are you on target, behind? What's your plan in that area?
Well, after doing a very thorough review, we are prioritizing the funds that we do have available. And that's what we'll have to do as we're going forward. Some of the maintenance that is not necessary, that doesn't deal with the value for use or public safety, health concerns, we'll have to defer that to another time.
Well, I trust your able staff to do that. Thank you, Mr. Secretary.
Thank you.
Thank you, Mr. Chairman.